Now, if you nap, I have a few suggestions around that. I would suggest that I guess the guidelines that we say around napping, I understand that with certain types of ongoing pain, tiredness just is part and parcel of the condition. So fibromyalgia, for example, or that just the part of the pain is being tired and can't avoid not having a nap. But I would suggest that the guidelines around that are shorter naps are better than longer naps, and earlier in the day is better than later in the day. So having a half an hour nap at 1 o'clock, in fact, Europe is an example where they actually have institutionalized having, these break periods in the middle of the day for people to possibly take a nap. At around 1 o'clock is much better than, a 3-hour nap at 5 o'clock in the afternoon, because you get up at 8 o'clock, again, your body starts to not know when the start of its day is, and you're much less likely to be able to get to sleep at 11 o'clock or 12 o'clock if you've slept until 8 o'clock at night. Okay, having a cool, quiet, dark bedroom can be important. These are things that you just have to just take a look at. Is your environment one that's suitable for you to be able to get to sleep? Cool. I understand there's some variation in sort of personal preference here. Some people like to be kind of under a whole bunch of blankets and really feel comfortable that way. Other people will throw off the blankets and throw open the windows in the middle of the winter. But by and large, what's recommended is around 68 degrees is the optimal temperature. But again, taking into account some individual preference there. Quiet and dark for obvious reasons. Quiet, some people like to buy or may need, depending on their environment, may need to purchase earplugs to help with sleep. Unfortunately, the thing with earplugs is that their comfort level is directly related to the amount of money that you're willing to spend. So buying these little yellow things that you can squeeze and stick in there, usually that are very cheap, that usually will start to become very irritating after about 10 minutes or so. And whereas you can get some ones that are custom molded to the shape of your particular eardrum, and they might run you a few $100s to do that. Dark, again, some people will put in an extra layer of drapery just to make sure that their environment is totally dark. So the second point there is just avoiding caffeine and tobacco products. Caffeine and nicotine in the tobacco products are central nervous system stimulants. Okay, everybody is aware of the fact that caffeine is found in coffee and a lot of black teas, soda pop, chocolate. Most people are aware of that. And people's sensitivity to caffeine varies considerably. Some people are incredibly sensitive to it and really cannot have any caffeine after 12 o'clock in the afternoon in order to, and then other people can get by with having a coffee after dinner and being able to sleep okay that night. But again, it's one of those things that if that is one of the things that you're unsure about, then it might be worthwhile to try cutting out the caffeine for at least past 12 o'clock. Tobacco products, nicotine, as I said, is central nervous system stimulant, can be, especially if a person is smoking a lot in the evening or using a lot of tobacco products in the evening, can delay a person's ability to get to sleep. Alcohol is the opposite, actually. It's a central nervous system depressant, and it can help a person get to sleep, at least initially. But aside from the problems on other systems in your body, such as your liver, alcohol can wear out of the system, wear out of your system, and you can get a rebound phenomenon in the middle of the night. So it might help a person get to sleep, and then as it wears off out of the system, a person can rise out of that sleep in the middle of the night and sometimes even experience rebound anxiety. So again, it's not a good long-term sleeping pill. Okay, we do recommend to exercise to the extent that you can moderately in the late afternoon or the early evening. And even we don't want to go to bed with a totally empty stomach or after just eating a huge meal. So we suggest having a light snack, perhaps with warm milk in the evening. Want to avoid using sleeping pills for too long. Now, this is one of the areas where you do need to talk with your family doctor about that. Some people can be on sleeping medications for a longer period of time. And I'll have a couple words to say, actually, about the different types of sleeping medications. And the second, so there's two main types here that we're going to talk about. And one of them is in the class of the first type of sleeping medication, which probably a lot of the ones that you would identify as sleeping medications are in this class of medications called benzodiazepines. And what we know about them, besides the fact that they are considered fairly addictive right now, that these medications actually can influence the different stages of sleep. So while they can help a person get to sleep okay, now not all of these medications are the case, but a number of them are. Well, it can help a person get to sleep. They can interfere with the ability to get down into the deep stages of sleep. So you could say, well, they take a sleeping pill, but when they wake up in the morning, the person may say, I'm not really feeling very refreshed, and that may be because of the interference on the ability to get down into the deep stages of sleep. They're generally designed for short-term use or periodic longer-term use. But okay. Now, having said that, I've talked to people that have been on these medications for a long period of time, but again, you generally want to have that discussion with your family doctor. One of the medications that is being used for a longer period of time that helps with sleep are in a class of medications that are antidepressants, actually, but usually they're not prescribed for depression themselves. So your family doctor may put you on a medication and you'll see that it says, well, it's an antidepressant to help with sleep. It may not be given to you for that fact. Usually they're given in much smaller dosage than would be given for depression, but you're actually taking advantage, if you want to think of it that way, of a side effect of the medication, which is to promote sleep. And so as I said, usually given in a small dose, smaller than would be given for clinical depression, and they're thought to be safe for longer periods of time. Now, I'm not going to say a lot about the sleeping position, but a couple of things to keep in mind is we want to find a sleeping position. One of the guidelines here is that you have what we call a neutral spine, so that a spine in which the three curves are maintained, and one that puts a least amount of strain on the spine and supporting muscles and ligaments. So in terms of sleeping surface, you want to find one that's comfortable for you. It's got to be supportive. That's the most important. Supportive to support those different curves in your spine. So it doesn't have to be too hard, but one that's more supportive would be the guiding feature there. And the final point there is to use pillows. Lots of pillows to create those curvatures in the spine, to prevent yourself sometimes from rolling over. Be inventive with the use of pillows. They can be quite helpful.